What is bone marrow suppression in leukemia? Imagine your body's blood cells as tiny workers inside your bones, each with a vital job. Red blood cells carry oxygen, white blood cells defend against infections, and platelets help your blood clot. All these cells are made in the bone marrow, a soft, spongy tissue inside your bones. In leukemia, something unusual happens. The marrow starts producing abnormal white blood cells called leukemic cells. These cells multiply rapidly and crowd out the healthy cells, disrupting normal blood cell production. This process is known as bone marrow suppression or myelosuppression. When the marrow is overwhelmed by leukemic cells, it can't produce enough healthy blood cells. This leads to a condition called cytopenia, where there are too few blood cells of certain types. For example, low red blood cells cause anemia, which makes you feel tired, weak, and short of breath. Low white blood cells, especially neutrophils, lead to neutropenia, increasing your risk of infections. And low platelets, known as thrombocytopenia, can cause easy bruising, bleeding, or tiny red spots on the skin. The main cause of bone marrow suppression in leukemia is the disease itself. The leukemic cells take over the marrow space, blocking normal blood cell production. This is different from marrow suppression caused by treatments like chemotherapy or radiation, which are external factors that can also temporarily reduce marrow activity. In leukemia, the suppression is a direct result of the disease process, where abnormal cells dominate the marrow. This suppression can have serious effects. Patients may experience fatigue from anemia, frequent infections because of low white blood cells, or bleeding issues from low platelets. These symptoms often lead to medical tests, including blood counts and sometimes a bone marrow biopsy, where a small sample of marrow is examined under a microscope. Treatment aims to control the leukemia, often with chemotherapy, targeted therapy, or stem cell transplants, to reduce the number of leukemic cells and allow the marrow to recover. Supportive care like blood transfusions or medications to boost blood cell production can also help manage symptoms. It's important to understand that bone marrow suppression in leukemia is mainly caused by the disease itself. While treatments like chemotherapy can also suppress marrow function temporarily, the primary issue in leukemia is the overgrowth of abnormal cells. Successful treatment of the leukemia often leads to the marrow regaining its ability to produce healthy blood cells. In summary, bone marrow suppression in leukemia happens because leukemic cells take over the marrow, preventing it from making enough healthy blood cells. This results in symptoms like fatigue, infections, and bleeding. Managing this involves treating the leukemia and providing supportive care to help restore normal blood cell levels. If you or someone you know is affected, always seek advice from healthcare professionals for diagnosis and personalized treatment options. Understanding this process helps patients and caregivers recognize symptoms early and work closely with medical teams for the best outcomes.